My name is Ovidiu Banea. I'm a clinical neurophysiologist in Iceland. And I will present this work using high-density EEG to assess TMS treatment in patients with schizophrenia. The aim of the present work was to describe cortical topography of the auditory evoked responses like P50 and the N100 P300 complex in healthy participants and patients with schizophrenia, and to define a robust methodology signal quantification using dense array EEG. Schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves, and it has a multifactorial origin. It is thought that an interaction between genes, environmental, and probably psychosocial factors may cause schizophrenia. It has different types of symptoms: positive, negative, and cognitive. We are now talking about positive symptoms like hallucinations. These are important for our work. So then cognitive symptoms in schizophrenia, like executive functioning, it seems that it's poor in these patients. And this is due to their paying attention or sensory gating. So sensory gating dysfunction. Sensory gating, it's what we filter from the environment. So in schizophrenia, most studies of magnetic resonance imaging show the gray matter volume reduction of supratemporal gyrus, and this supratemporal gyrus, it's a region in the brain close to the Heschel gyrus, which we see it here, and it's related to a language-related area. So from here, it's supposed that we have those, not we, the patient with schizophrenia, those symptoms. So this left temporal parietal side, I'm showing here the right, but it would be the left. It's a switched camera. So this region, it's important to look to it in patients with schizophrenia. Regarding auditory verbal hallucinations, as I said, it's the most common positive symptoms in schizophrenia. And the first treatment option for these hallucinations is antipsychotic medication. Even so, 20–30% of the patients are not ameliorating. They are refractant, medically pharmacoresistant. So this is important to alternative emerging treatments. In 1999, Hoffman and his colleagues started to explore TMS for treatment auditory verbal hallucination. And they started to treat exactly this region. So they applied the coil to the left temporoparietal cortex. So this region, it's showing a paradox in patients with auditory verbal hallucinations, as if we don't have an external stimulus. It was seen with MRI studies that it's shows increased activation. So when we don't have any sound around, patients with auditory verbal hallucination has a hyperactivation of this left temporal parietal region, and decreased activation when they were exposed to sounds. So MRI studies showed when the patients with schizophrenia listen something real, that they have a decreased activation. And if it's the absence of the stimulus, it was increased activation. So what Hoffman and colleagues started in 1999 was to decrease this hyper function in patients with schizophrenia. So this they applied a coil. It's called. I will tell you briefly what is TMS. to the left temporal-parietal cortex, and they observed decreased in severity of this auditory hallucination. So I will stop this. We will come back if we have time later. So what is TMS? TMS is a technique in which a strong pulse of electrical current is sent through a coil to the person's skull, and this induces a magnetic field to a small brain area, depolarizing local neurons up to a depth of 2 centimeters only. So we can say that we stimulate or we activate neurons just below the skull. And when it's repetitive, if we apply this for several minutes or several days, it might induce neural plasticity or long-term potentiation or depression of the neuronal level, long-lasting effects. So the problem in these years, since 1999, was that all the outcomes measurements for this auditory verbal hallucination were measured with subjective psychometric scales, which are instruments. We ask the patient how they listen the hallucination before and after the treatment, but no objective measurement was done until now. So sometimes recently there are some studies with EEG, but we wanted to explore this by the point of neurophysiology and to assess more objectively what happens in the brain, biological neural networks. So even this study recently started in the United States. It's using, again, hallucination change scale. It's a subjective scale, not objective measurements. So from neurophysiology and schizophrenia, we know that in a baseline condition, the patient showed decreased amplitude for cognitive event-related potentials, suggesting neurophysiological deficit of the sensory cortex. So this is important for this study we did, and we are still doing because we just started it. So in our protocol design, we were using 10 days TMS session, transcranial magnetic stimulation, as I said, over the left temporal parietal region, and we wanted to compare with this vertex treatment region. And then we measured the brain activity with clinical outcomes, like was done until now, and with some electrophysiological parameters before and after the treatment. 3 patients we showed here data have been recruited from psychiatric wards with persistent auditory verbal hallucinations. And 3 healthy participants were recruited by convenience sampling and went to a mini. It's an interview to show that we don't suffer any psychiatric disease. So what is P300? In this work, we show the data from N100 P300 complex and the P50. So they are auditory evoked responses, and they happen, as the name is saying here, at 300 milliseconds after a sound stimulus it's given. And it was shown that this P300 showed reduced amplitude in patients with schizophrenia in comparison with healthy subjects. So what we did, it's a known oddball paradigm, P300. I can simulate it like beep, 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 beep with another tonality. So sometimes a rare stimulus appeared with another intensity. So this is a P300 mainly. So we delivered the trial of 160 tones, which occurred randomly, and we had the probability of 0.2 to occur this random. So then this complex values for each, we calculated from high density EEG, and I will show you the regions of interest from 7 regions of interest using high density EEG, 256 electrodes. So we were measuring this complex from N100, which is a first component of this complex, to the P300. So here we cut a window like that, and automatically using MATLAB, we calculated this voltage. So this is N100 P300 complex. And then for the P50, the other measurements, this is more known for psychiatrists and neurophysiologists in the field of schizophrenia research. And it's a component which a most positive peak at around 50 milliseconds after a sound. And this paradigm is a little bit different than the other one. It's like tit, tit, and then 10 seconds pause to let the brain staying, and then tit, tit. It's a paired click paradigm. So the normal subject will have this second responses gated, while the schizophrenia patient will have failure to suppress this stimulus. And this is a P50 paradigm. So sensory, this is measuring sensory gating. What I said at the beginning, that the schizophrenia patients do not have this sensory filtering. So then we did this per click paradigm, and the P50 suppression was calculated as a ratio of mean value of the S2, the testing sound, to the conditioning sound. And again, we measured those voltages from 7 regions of interest. These were the epochs for P300. We had an epoch of 1,000 milliseconds, started 100 milliseconds prior to the auditory stimulus, and for P50 the epoch was 500 milliseconds. Here are the regions of interest. So we recorded with high density EEG, and we had the signal, and we averaged the signal from 15 electrodes in each region. So we had the medial line, midline 3 regions, right side of the brain 2 regions, and left side of the brain 2 regions. Here it's a region of interest. As I said, the patient with schizophrenia is known that they have less P300 and less P50 suppression over this area. So our research hypothesis was that the P50 suppression ratio decreases or improved sensory gating after the TMS treatment, and that the voltage of N100 P300 voltage increases. So these are the stimulation of the patient group on the left temporal parietal region, and then we used as a control CZ or vertex stimulation. This is a bird from Iceland, very well known, as you know, the puffin. So main results, we observed the major P50 suppression or reduced ratio in healthy participants. As it was supposed, and that these patients, these healthy subjects have a better sensory gating, and they had this suppression better in the left posterior regions where we applied the stimulation. But this blue are the healthy participants. So why this, we don't know, and this is very, very difficult, and we are at the very beginning, and we suppose that this impaired sensory gating is because of the altered brain regions on this patients group, or that sensory gating is better in this region in the healthy subjects. But then we have the N100 P300 complex results. In schizophrenia, we didn't got these responses, and this was after 10 days of TMS. It's only one patient here shown, and this is interesting, and it's difficult to assess with these protocols. So as we can see here, our hypothesis was that this ratio will decrease. So here we have healthy participants comparison, and here we have one patient before and after. This suppression increased after the treatment, which was against of our hypothesis. So this means that we failed to demonstrate that suppression after 10 days TMS. And then the other findings for the voltage of N100, P300 is, yes, they improved this complex of attention, but we only had 2 patients here, so we are very, very little data, and we have limits, of course, to interpret this. The main problem
left.
Sorry, yeah, thank you. So with this study, we proved that recordings of P50 and N100, P300 is possible using high-density EEG 256 channels, and the results in healthy subjects are reproducible and show similar topography when studying the different regions of interest. For the patients, we observed that P50 are very difficult to measure. This is a very, very small component. And then N100, P300 might be suitable to be measurable in these regions. And we have to have in mind some future directions. As I said, that this P50, it's very small, so we suggest to measure N100 component in this paired click paradigm, and also analyzing EEG neural oscillations, or following other methods to assess connectivity. Here we have an example. This is an ongoing analysis we are doing to understand. This is a P50 component, and this is an N100 component. This is S1, the blue one, and the red, it's just the gated signal in a healthy participant. So it's very difficult to assess this difference. But if we look to this component, it will be better. Then we have this paper published today in Frontiers by my colleague and our team. And here we have event-related oscillations related to those components. So here is a time domain, and here is a spectral data from this component. So this is a future. And then we have another working study with connectivity. So we have to address this with the connectivity, coherence, and other methods. And thank you so much. If you have questions.